I just want to start by saying, what's the point of using evidence for policy making? Why do you need to, just step back and say, why do we need evidence? And I just want you to think about these few things which are critical, because if we don't have evidence, what we would see is a lot of wasteful spending. And I think all of us working in India do see a lot of that around us. We wouldn't be able to expand innovative programs. India on the global stage is known as the graveyard of pilots. How are we going to scale these up? So that's an important thing to think about, that if we don't use evidence for policy, we probably will continue to have pilots happening and policy moving in a different direction. And most importantly, evidence-based policy should help in strengthening accountability. Again, if you think about this, that's probably our biggest challenge in India at the moment. Just, if I were to just think about, again, evidence-based policy, there are two sides to this. There's evidence-based policy formulation, and when we go around, we see a lot of policy documents that probably had some evidence behind them, which are sitting on shelves across the country, across states, which aren't really being used. And then there's evidence-based policy implementation, what we've just heard a little while ago, that are we using evidence as we go forward in implementing our policy? And there I think one of the larger problems that we face currently, while we have started focusing on evidence for policy making to a certain extent, but there is a challenge of a policy being formulated and then, it's like, okay, job done, let's go home. But actually, as new evidence starts coming in from the ground, are we okay to go back and look at our policy and say, is it even working? And we've had many examples from within the Indian system where we've had policies which were set up based on probably some evidence of some sort. We've gone back, we've started implementing, and we've realized things are not working, but are we okay to course correct? So this is a huge challenge. And I think, I'd really like to draw your attention to this, because if we don't course correct, we're not going to get the results that we're looking for. And that needs to be a continuous process. So evidence gathering needs to be a continuous process, and course correction needs to be a continuous process. And a lot of that is to do with the capacity of decision makers, even the policy formulators. Are they actually in a situation, or do they have the capacity or the understanding to use that evidence, which is coming from the ground, from all the great work that all of you and the panelists have been doing on the ground? Are we actually able to understand that? Are we able to convert that into policy in a coherent, sensible way? Is a big challenge that we need to face. Finally, do they have the time? Do they have the commitment of time? Do we have the human resources to be able to do that? Dr. Sanjeev Kumar just took us through the whole policy of the national the whole process of the national health policy guidelines and how they were developed. And I can already sort of tell you from what I heard and what, we were part of some of those discussions, it was a heavy lift. It wasn't easy. A lot of times we were probably just ticking the boxes. It needs a lot of hard work. There is evidence, there's great evidence from across the country which should be used for this. I'm not sure if we managed to capture most of that, a lot of that, a little bit of that, the better ones or the more vocal ones. I'm kind of wondering, did we actually get the real good examples which should help us make those decisions? Some other challenges. In India, funding for evidence generation is very limited. And I think we find that most of the funding that we do have for evidence generation is coming from global organizations. So I think that's another area where probably India needs to pull up its socks and start. I work for PATH, and we have been working on we've done a lot of work on evidence generation, which would help policymakers make decisions. We worked on many kind of devices, cost-effective technologies. We're essentially focused on innovations. Rice fortification, it's a technology. Hopefully, we'll add micronutrient content into the rice. Just to give you an example, the rice fortification, we started about 10 or 12 years ago. And after 10 or 12 years of evidence, we finally saw the policy seeing light last year. So it was a heavy lift. It's in the policy environment, but we still have to see how the implementation works. And more importantly, as we implement, are we learning from that and changing policy? A very interesting, big achievement that we just had was on oxygen. And I think all of us have been following the story in Gorakhpur. So PATH globally has been working on advocating for oxygen to be part of the essential medicines list of the WHO. And it's taken us so many years to convince WHO that this is essential. So I think that's another very important thing to remember, that it's generating evidence costs a lot of money. It takes a lot of time. It's very important for policymakers to look at that, to weigh in the pros and cons. There are always suspicious agendas, which we have to be careful about, and the policymakers have to be really careful about that. And I think, we should be very, very mindful of that. On private sector, and we talked about that. Just to give you an example of what happened, so private sector engagement has been a big sort of challenge in India. 70% of our people are going to private sector. They're not, including people without money. They're not going into the public health system. TB can't be eliminated without bringing the private healthcare providers in. So we ran a program in Mumbai for 3 years, figured out how this could work in partnership with government. That went into the National Strategic Plan for TB elimination. That is now moving ahead, where the government has identified 200 districts across the country where they would like to push that forward and engage with the private sector. The challenge still is that most of the private sector is unorganized, not registered, so you can't actually even acknowledge that they exist, while you still need to bring them into the fold. So lots of challenges around the whole legal side of it. Just some random thoughts. I hope they've been helpful. Thank you so much.